Hello everyone, welcome to Bit of Anatomy. In this gross anatomy lecture, we will see the second part of the face, the nerve supply, the blood supply and the lymphatic drainage. So first if we see the nerve supply of the face. So of course since there are many muscles here, there will be motor nerve which supplies the muscles of the face and there will be numerous sensory nerves which supplies the face. All the muscles of the face, if you see the development of these muscles, they develop from second branchial arch. So because of this, the nerve of the second branchial arch is the facial nerve. The facial nerve supplies branches to all the muscles of the face. Whereas the sensory nerve supply, if we see, it is mainly supplied by trigeminal division through its various trigeminal nerve through its various branches, and a small part even from directly from cervical spinal nerves also supplies the face. First, if we appreciate the motor nerve supply. So as I said, it is supplied by the facial nerve, which is one of the cranial nerve. So it enters the face through the or within the parotid gland, and within the parotid gland itself, it divides into 5 branches. So depending upon the direction of the branch, we can name those branches and approximately what all muscles are present there, those muscles are supplied by these branches. So if you see the first one, that is the thumb here, so it is going towards the temporal region, so it is called as temporal branch of the facial nerve. Then if you see this branch which is going towards the eye, so it is passing it is passing over the zygomatic bone, so it is called as zygomatic branch. And the third branch which passes towards the mouth, so it is called as buccal branch, which again has got an upper and lower buccal which supplies muscles of corresponding region. And the fourth branch, if you appreciate, it is lying near the base of the mandible, so this is known as the marginal mandibular branch. And the fifth branch, it is actually going to the neck region, it is called as the cervical branch, which supply the muscle in the neck called as platysma, so which arises from the thoracic region, muscle of the neck region, but developmentally it develops from second pharyngeal arch, that's why it is supplied by the cervical branch. So these are the 5 motor branches: temporal, zygomatic, buccal, marginal mandibular and the cervical branches. Now if we see the sensory nerve supply of the face, so the sensory nerve supply is mainly from various branches of the trigeminal nerve. So if we divide the various areas supplied by 3 divisions of the trigeminal nerve, we can take a line from angle of the eye, lateral angle of the eye to the vertex of the skull. Again a line from lateral angle of the mouth joining the same line, and a small part of angle of the mandible is excluded, and one more line coming from medial angle of the medial angle of the eye to the nose. So this divides it into 3 divisions. So the upper division is supplied by ophthalmic branch or ophthalmic branch of the trigeminal nerve. The middle division is supplied by maxillary branch of trigeminal nerve, and the lower part is supplied by mandibular branch of trigeminal nerve, and this small part, it is supplied by a branch of the cervical plexus which is called as great auricular nerve. So now if you appreciate what all branches of ophthalmic nerve, maxillary and mandibular are present here to supply the skin of the face. So there is a branch just above the eyelid, so which is called as lacrimal branch, and there are 2 branches extending into the forehead and also even into the scalp. The medial one is called as supratrochlear and the lateral one is called as supraorbital. So then over the nose, there is one more branch called as infratrochlear, and the external nasal nerve. So all these are branches of the ophthalmic division of trigeminal nerve. Whereas the maxillary division, it provides three branches. So one is present below the orbit, so which is known as the infraorbital, and then one is related to the zygomatic region or emerges from the zygomatic bone and supplies the face, and one will emerge from the zygomatic bone and goes towards the temporal region. So this branch is called as zygomaticofacial, and this is known as zygomaticotemporal, since it goes towards the temporal region. So these are the three branches of maxillary division: infraorbital, zygomaticofacial, and zygomaticotemporal. So if you see branches of mandibular division, again there are three branches. One near the anterior part, which emerges from a foramen called as mental foramen. So it is called as mental nerve. And then there is a branch which passes in front of the ear, winding around the mandible. So it supplies both the ear and also the temporal region. That's why it is called as auriculotemporal nerve. So auricular refers to the ear, temporal refers to the temporal region. And one more nerve will pierce the buccinator muscle and enters into the face region. So it is called as buccal nerve. Remember, this buccal nerve is different from that of the buccal branch of facial nerve. So it is motor in nature. This is sensory in nature. So these are the various sensory nerves. Mainly all of them, they are coming from trigeminal nerve, which divides into ophthalmic, maxillary, mandibular division. Ophthalmic division which supply the upper part, middle part maxillary, lower part mandibular, except the angle of the mandible which is supplied by great auricular nerve, so which is a branch of cervical plexus carrying a root value of C2 and C3. So these are the sensory nerves of the face. So now if we appreciate the blood supply of the face, which includes both the arteries and also the veins. First, if we appreciate the arteries, so the major artery that supplies the face is known as the facial artery. So this facial artery, it arises at the level of the hyoid bone or at the upper part of the hyoid bone from one more larger artery which is called as external carotid artery. So it is a branch of external carotid artery. From this external carotid artery, after its origin, it has got a course in the neck region where it is related to various parts of the mandible, and it enters the face at this point, which is nothing but antero-inferior angle of a muscle in this region called as masseter muscle. So it is important because the facial artery can be palpated at this particular point. So usually used by the anesthetists during surgeries, they use this point to palpate the pulsations using the facial artery. So once it enters the face, so it has got a tortuous course. It reaches the point which is around 1 to 1.25 centimeter from angle of the mouth. Then it passes tortuously to reach the medial angle of the eye. So enters the face, loops around the mandible, enters the face at antero-inferior angle of mandible, has got a tortuous course, reaches 1.25 centimeter lateral to the angle of the mouth, then passes towards the medial angle of the eye where it will anastomose with some of the branches like supraorbital and supratrochlear arteries. So why it is tortuous in its course? So as you all know, the face contains numerous muscles and there will be various movements in relation to the upper lip, lower lip, and even muscles in relation to the cheek region. So when these muscles are contracting, so there should not be any damage to the artery. So that's why it is tortuous in nature. It allows the movement for various facial muscles. So that's why it is tortuous. So if we appreciate the branches of this facial artery in the face, in the neck it gives various branches to the supraoid branch, a cervical branch it will give in the face region. In the neck region. In the face, it provides a branch to the lower lip, to the upper lip, and also to the nose. So these branches, they are correspondingly called as inferior labial artery. So going to the lower lip, the superior labial artery, going to the upper lip. So this superior labial, it also provides some branches to the nasal septum or to the nose, and the lateral nasal artery, which supplies the lateral part of nose or the external part of the nose. So these are the three named branches in the face. Apart from that, it gives few small muscular branches to supply the muscles of the face. So this is the major artery in the face region. So apart from this, there will be one more branch. So this external carotid will give a branch called as the superficial temporal. From this superficial temporal artery, so this is called as superficial temporal artery. From this artery, there will be a small branch, not always present. In some it is very prominent, in some it is completely absent. So this artery, it is known as the transverse facial artery. So which is a branch of superficial temporal artery. So apart from these two major branches, all these sensory nerves that we saw, like supraorbital, supratrochlear, infraorbital, all these are accompanied by small branches, small vascular branches. They will also supply the face region. But anyway, the major branches are the transverse facial and also the facial artery. So if you appreciate the venous drainage, veins correspond to the arteries, some of the veins. So there will be two veins in the upper part. So coming from the scalp region, so which corresponding to the nerves of the same name. The medial one is called as supratrochlear vein, and the lateral one is called as supraorbital vein. So these two veins, they will unite to form what is called as angular vein. So it is called as angular vein because it is situated near the medial angle of the eye, and this will continue as facial vein. So this facial vein, it is present behind the facial artery, and in contrast to the facial artery, which is tortuous, it is very straight in course. So this is nothing but the facial vein. So at the same time, there will be a vein here along with the superficial temporal artery, so which is called as superficial temporal vein. So this superficial temporal vein, it will join with one more vein called as the maxillary vein. So and it forms a vein in this region known as retromandibular vein because it is present behind the mandible. So this retromandibular vein, it divides into an anterior division and a posterior division. So this anterior division of the retromandibular vein, it will join with the facial vein, forming one more vein called as common facial vein, which will drain into a larger vein that is nothing but the internal jugular vein. So supraorbital and supratrochlear vein unites to form the angular. Angular will continue as facial. Facial vein will join with the anterior division of the retromandibular vein to form the common facial vein, which drains into the internal jugular vein. Similarly, the posterior division, so it will join with one more vein called as posterior auricular vein, If you remember, all these veins, they are nothing but veins coming from the scalp region. So this will form a vein here, which is called as external jugular vein. So you should include both this and this along with the venous drainage of the face. So in relation to the venous drainage, there are some important communications of these, especially the facial vein. It communicates with a group of veins or group of venous sinuses inside the cranial cavity called as cavernous sinus. So cavernous sinus is something which is present inside the cranial cavity. So to this cavernous sinus, the facial vein communicates by two routes. One is through this supraorbital and supratrochlear. A vein passes within the orbital cavity, so which is called as superior ophthalmic vein. So that is one route of communication. One more route is through the veins that are present in the nose. There will be a vein which communicates with the venous plexus in relation to the pterygoid bone or pterygoid plate of the sphenoid bone. So this is called as pterygoid venous plexus. So and this pterygoid venous plexus, in turn, it will communicate with the cavernous sinus. So these are two routes of communication. One is through the superior ophthalmic vein, then one is through this vein which is called as deep facial vein. It communicates with the cavernous sinus. So what is the importance of this? So the importance of this communications between the facial vein and cavernous sinus is this facial vein, it is wall-less in nature. And if there is any infection, especially in the philtrum region, the upper lip and also part of the nose region, so if there is any infection here, so during contraction of the muscles, what happens? That infected substance or the bacteria might enter into the facial vein, and through the facial vein it might lead to infection of the cavernous sinus, which is little dangerous. So that's why this region, it is called as dangerous area of the face, which includes mainly the middle part of the upper lip and even a part of the nose. Some consider only this small part as dangerous area. Some consider this triangular region as dangerous area of the face, through which the infection can spread, usually through the deep facial vein, pterygoid venous plexus, and to the cavernous sinus. So this is about the venous drainage of the face, the facial vein, common facial vein, the retromandibular vein and its divisions, drains into internal jugular and also helps in formation of the external jugular vein. And in the end, if we appreciate the lymphatic drainage of the face, so the lymphatic drainage is divided into three regions. So by passing a line from the angle of the mandible, which passes through the ear, middle of the ear and reaches the skull, so that is one line. Next line again coming from the angle of the mandible, which cuts the eye in two halves and reaches the forehead region. And the third line from the base of the mandible, it reaches the lower lip, leaving its lateral part. So this upper area, so this is the upper area, so this is the middle area, and this is the small lower area. So this upper area lymphatics will drain into a group of lymph nodes which is present in relation to the parotid gland or in front of the ear. So this is called as parotid group of lymph nodes or preauricular group of lymph nodes. Whereas the middle area, which includes medial part of the eye, a small part of the forehead, the nose, the upper lip and even a small lateral part of the lower lip. So all these will drain into lymph nodes which are situated in relation to the submandibular gland in the submandibular fossa. So this is nothing but the submandibular group of lymph nodes. And this small area, which includes the medial part of the lips and the chin region, so it will drain into few lymph nodes which are present just below the symphysis menti called as submental lymph nodes. So this is the lymphatic drainage. The parotid group, the upper area, the middle area or the intermediate area drains into submandibular, and the lower area drains into submental. So these are the features of the face you should know. So do subscribe for future updates. Thank you.